am Mr. Nagaraju, working as an audiologist in the Department of Audiology at All India Institute of Speech and Hearing, Mysuru. I will be moderating today's session, Health Organization. The main objectives of celebrating World Hearing Day is to raise public awareness about how to avoid deafness and hearing impairment, as well as to support ear and hearing care around the world. The theme for this year is to hear for life, listen with care. This year, World Health Organization will focus on the importance of safe listening as a means of maintaining good hearing across the life course. Today's program is about ear care, earwax and ear discharge, which means how to take care of our ears and what are all the precautions that we need to take to avoid ear infections. We will also be discussing treatment and rehabilitation options that are available for ear-related infections and hearing loss. With this brief overview about the topic, let me begin the program. I would like to introduce the resource persons. Area of interest is tinnitus and hyperacusis, auditory physiology and amplification devices. Welcome you, Dr. Prashant Prabhu.
Thank you.
Remember, this is a live phone-in program and our resource persons are here with us to answer all your questions. You can reach us by calling this number on 0821 250 2530. I'll repeat once again, 0821 250 2530. The number is also displayed on the screen. I once again welcome you all for today's live phone-in program. Dr. Swati, generally we see earwax formation in the ear canal. How it will form in the ear canal, and is earwax formation is good or bad?
Okay, so earwax is really a common problem which we come across in our day-to-day life. So before we proceed on to the topic proper, I would like to outline the basic anatomy of our ear. So as seen in this model, this is our ear, human ear. So here we can divide it into the outer ear, middle ear and the inner ear. So basically into three components. And coming back to this topic on wax formation. So as you can see here, this is the outer ear. So this structure is the canal wall. So here the outer canal wall, the skin lining is cartilaginous and the inner aspect is bony. So this main difference is responsible for our understanding in wax production. The outer aspect of the ear canal contains hair follicles and also the lining epithelium, which is stratified squamous epithelium, along with the ceruminous and the sebaceous glands. So as you know, the skin lining our body undergoes a periodic process of maturation. So the same thing will apply to our ear as well. So from the basal layer, the cells periodically undergo maturation, and in addition to this, the secretions from the ceruminous and the sebaceous glands, so all put together results in what is known as the wax production. So wax production is good because it has an antibacterial property, and the wax which is present in our ear canal will help in trapping the dust as well as the foreign body.
So, Dr. Prashant, like earwax formation, how it will be formed in the ear canal was explained by Dr. Swati. Is earwax formation is affecting the hearing of the person?
Yes, so to answer to your question, as ma'am explained, so there are different parts of the ear, and as ma'am said, there is something called as ear canal where the wax gets accumulated. So as ma'am said, it is earwax is something which is not harmful. It is there to help our ears or protect our ears from dust, from something entering into our ears, from water getting entered into the ears. So wax is actually good, which protects our ear, that is our middle ear and the inner ear. But if wax gets accumulated too much, then that can lead to hearing loss. So not everybody who has wax will get hearing loss, but those people who get hearing loss will have excessive accumulation of earwax. That is, as ma'am said, it's a canal. So if I have a wax, that wax, if it completely blocks the ear canal, then the sound from outside cannot go inside. So because of that, the person experiences hearing loss. It's just like if you have something in a pipe and the pipe gets completely blocked, the water cannot go inside. Same way, if there is complete wax accumulation, only then that leads to hearing loss. But if there is any partial wax, then the sound can still go through the other pathway, so that may not lead to too much of a hearing loss. Even if there is a complete blockage, it leads to around 10 to 20% of hearing loss. So you may experience that you're not able to hear properly. So, and another symptom that you can get if it gets blocked is like you may get a ringing kind of a sensation. We call it as tinnitus. So that can also occur. So wax, if it's accumulated too much and it completely blocks the ear canal, then it can lead to some amount of hearing loss.
Thank you. So, Dr. Swati, earwax formation will be there in the ear canal, right? So, how it can be removed? Some person will be removing by their own, by putting some objects in the ear canal. Is that safe to remove, or is there any procedure to remove the earwax?
So, like I said before, it is a normal process occurring in our ears. So, what people tend to think, or what they try to do is, okay, wax formation might not be good for us, it has to be cleansed regularly by us. So, what they do is, just imagine this to be an earbud. So, in the process of when they insert it, they might assume that they might be getting out the wax to the external aspect. But in the process, what happens is, they'll tend to push it more inwards towards the eardrum. So in the process, the wax, than coming out, it will just further pressurize on our eardrum, resulting in earache. And of course, like how our colleague told about deafness, that is reduced hearing. And in some instances, this act can itself result in causing ear infections. And also, it can result in a perforation of the eardrum. So this should not be practiced.
We'll just take a look.
Yes, sir.
Hello.
Hello.
Hello. Hello, madam.
Hello. I am speaking from Maharashtra.
Okay,
My name
yeah.
is Urvi.
Please ask your question.
Yes. Actually, since 3 days, I have blocked sensation. My ear is blocked, I feel, and I have itching in my ear.
Okay.
So it pains a lot also,
Okay.
especially my right ear.
Okay.
So who can I consult? I'm really worried about it, and who can I consult for that?
Okay. So our Dr. Swati will answer to your question.
Good afternoon, ma'am. Before we prescribe you any medications, we would like to have a look at your ear canal. Is there any history of using earbuds or any such thing to clean your ears?
Yes, actually, I frequently use earbuds for cleaning.
Okay, I would like to advise you not to continue this practice, because just by the history what you're telling, you might be suffering from what is known as a fungal infection, otomycosis, because you did make a mention of ear pain and blocked sensation and itching. So it could be that, but nevertheless it can be an impacted wax also. So it's better you consult a ENT doctor and then proceed with the treatment.
Okay. ENT doctor, right?
Yes, ma'am.
Okay. And it won't be harmful, right? Anything ahead?
Kindly do not
So
delay.
not a concern, right?
It's better you consult the ENT doctor at the earliest, because we would not like for the complications to set in.
Okay, ma'am. Okay. Thank you so much for your guidance. Thank you. I will consult you.
Thanks for calling. I hope your question got clear, right?
Yes, thank you.
Okay.
Thank you.
So, Dr. Swati, we were discussing about how to
Yeah.
remove the earwax.
So, as I just made a mention, by inserting the earbud, so the wax will further be pushed inwards and it will be exerting pressure on the eardrum. So, the force might be so much that it can also result in the tear of the eardrum. So, this will actually increase the process of hearing loss and all that. So, it will be a vicious cycle altogether. So, keeping that aside, why we should not clean earwax as a routine or generally is that the outer aspect of the ear canal, which you can see here, it's yellowish in color. So as I made a mention, it has hair follicles. So these hair follicles, the main function of theirs is to direct the ear wax to the external aspect, that is outside the ear. Whenever we yawn or chew our food, because of the joint movements and also because of the hair follicle movement, normally or naturally the ear wax gets extruded outwards. So it is really not a good habit to insert anything to the ear, be it earbud or pin, pen, whatever may be the object. So I strongly advise not to use any of these instruments.
Again, for you only, Dr. Swati. What are the initial symptoms of any ear infection? As a first aid measure, what can a person do and what cannot be done by a home remedy?
So ear infection again, so it can remain confined only to the outer aspect of the ear, comprising the ear canal and the outer layer of eardrum, or it can also affect the middle component of the ear, which contains our eardrum plus the 3 small bones.
We'll just address phone call. Hello.
Hello.
Hello. Yes, please ask your question. Welcome to live phone-in program.
Sir, ನನ್ನ ಹೆಸರು ಯಶೋಧ ಅಂತ.
ಹೇಳಿ ಮೇಡಮ್.
ಸರ್, ನನಗೆ 9 ತಿಂಗಳದ ಮಗು ಇದೆ.
ಓಕೆ. ಎಷ್ಟು ವರ್ಷ ಅಂದ್ರಿ?
9 ತಿಂಗಳು.
9 ತಿಂಗಳು. ಓಕೆ ಓಕೆ.
ಸರ್, ಮಗು ಯಾವಾಗಲೂ ಕಿವಿ ಮುಚ್ಕೋತಾ ಇರ್ತಾನೆ.
ಹೌದಮ್ಮ. ಹಾಂ ಹಾಂ.
ಸೊ ಏನ್ ಮಾಡ್ಬೇಕು, ಇದು ಕನ್ಸರ್ನ್ ಮಾಡ್ಕೋಬೇಕಾ, ಹಿಂಗೆ ಯಾರ ಹತ್ರ ತೋರಿಸ್ಬೇಕು ಅಂತ ಗೊತ್ತಾಗ್ತಿಲ್ಲ.
9 ತಿಂಗಳು ಅಂದ್ರಲ್ವಾ?
ಹೌದು ಸರ್.
ಓಕೆ. ಡಾಕ್ಟರ್ ಸ್ವಾತಿ ಅವರು ನಿಮ್ಮ ಕ್ವಶನ್ಗೆ ಆನ್ಸರ್ ಮಾಡ್ತಾರೆ, ಒಂದ್ಸರಿ ಪ್ಲೀಸ್.
ಮೇಡಮ್, ಮಕ್ಕಳು ಇವಾಗಷ್ಟೇ ಲೈಕ್ ಈ ಪ್ರಪಂಚಕ್ಕೆ ಬಂದಿದೆ ಅಲ್ವಾ, ನಮಗಂದರೆ ಇಷ್ಟು ವಯಸ್ಸಾಗಿದೆ. ಸೊ ನಮಗೆ ಅಭ್ಯಾಸ ಆಗೋಗಿರುತ್ತೆ. ಇವಾಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಅಂದರೆ ವ್ಯಾಕ್ಸ್, ಗುಗ್ಗೆ ಅಂತ ಏನು ಹೇಳ್ತೀವಿ, ಅದು ಉತ್ಪತ್ತಿಯಾಗಿ ಹೊರಗೆ ಬಂದಿರುತ್ತೆ. ಸೊ ನಮಗೂ ಅದು ಒಂಥರ ಗೊತ್ತಿಲ್ಲದೇ ಅಡ್ಜಸ್ಟ್ ಆಗೋಗಿರುತ್ತೆ ನಮಗೆ. ಇದು ಪುಟ್ಟ ಮಗು ಇವಾಗಷ್ಟೇ ಬಂದಿದೆ ಈ ಪ್ರಪಂಚಕ್ಕೆ. ಸೊ ಸ್ವಲ್ಪ ಅದಕ್ಕೆ ಟೈಮ್ ಬೇಕು ಅಭ್ಯಾಸ ಆಗೋಕ್ಕೆ. ಸೊ ವ್ಯಾಕ್ಸ್ ಅಥವಾ ಗುಗ್ಗೆ ಅಂತ ಏನು ಹೇಳ್ತೀವಿ, ಅದು ಕಿವಿಯ ಹೊರಗಿನ ಭಾಗದಲ್ಲಿದ್ದಾಗ ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಇರಿಟೇಷನ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಇಟ್ಸ್ ಅ ಕಾಮನ್ ಫೀಚರ್, ಡೋಂಟ್ ಬಿ ವರೀಡ್. ಬಟ್ ಹಾಗಂತ ಒಂದು ಸತಿ ಬಂದು ತೋರಿಸೋದು ಒಳ್ಳೇದು. ENT ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡೋದು ಒಳ್ಳೇದು. ಏನಾದರೂ ಹಾಕಿ ಕ್ಲೀನ್ ಮಾಡಿದ್ರಾ ಕಿವಿನ, ಮಗು ಕಿವಿನ?
ಇಲ್ಲ ಮೇಡಮ್, ಅಂದ್ರೆ ಭಯ ಆಗುತ್ತೆ ನಮಗೆ ಹಾಕಕ್ಕೆ.
ಓಕೆ ಓಕೆ, ಫೈನ್. ಡೋಂಟ್ ಬಿ ವರೀಡ್. ಬಟ್ ಹಾಗಂತ ನೆಗ್ಲೆಕ್ಟು ಮಾಡಬೇಡಿ. ಒಂದ್ಸತಿ ಬಂದು ತೋರಿಸ್ಕೊಳ್ಳಿ, ಸೊ ದಟ್ ಯುವರ್ ಡೌಟ್ ವಿಲ್ ಬಿ ಸಾಲ್ವ್.
ಓಕೆ, ಸರಿ ಮೇಡಮ್.
ಯಾ,
ಓಕೆ ಅಮ್ಮ, ಥ್ಯಾಂಕ್ ಯು.
ಥ್ಯಾಂಕ್ ಯು.
So, as a home remedy, what persons cannot be done in the home to remove the earwax and other
so
things?
I'll just proceed with the question what you had asked me earlier pertaining to the ear infection. So as I had made a mention, when we divide the ear into 3 parts, so the infections can get confined only to the outer aspect, or it can involve the middle aspect as well. So accordingly the symptoms will vary. Initially let's concentrate on the outer aspect. So the normal skin lining and everything might get disturbed by the infectious process, and the most common symptom will be ear pain. The ear pain, ear being a very sensitive organ, it will have an excruciating pain which no person will be able to tolerate it, and they cannot just let it go away. So the first main symptom will be ear pain, followed by ear discharge, and of course if it is resulting in a fungal infection or anything, it can also result in a blocked sensation. Suppose in addition to this, if a person has ear discharge and ear pain, the middle ear problems can also give rise to it. In addition, there will be tinnitus, like what Mr. Prashant had made a mention of it, and also in some cases vertigo can set in. So these will be the symptoms in broad, as a whole. So when they come to us for consultation, then we will be able to delineate the cause, whether it is the outer ear infection or the middle ear infection. Now coming back to the next question of yours, what you had asked on the home remedies, it is better to avoid anything like to be taken care of at home. Like from the olden days, there is a custom to insert oil or any such thing to keep the ears cleaned and all that. And present day, many people say after taking a bath, some amount of water would have entered my ears, so it's better I clean it and all that. So kindly avoid all those practices. Based upon the infection, the appropriate medications will be given after a proper diagnosis has been arrived at.
So, Dr. Prashant, does these ear infections symptoms have any influence on hearing, such as causing vertigo or any other related tinnitus related issues will be there?
Okay, so as Madam explained, so there can be middle ear infections that causes ear pain, ear discharge, and all those symptoms because of that, because of a middle ear infection. So that can affect hearing also. So the reason for that, why our hearing gets affected is when the sound passes from your ear canal, it goes to a part called as the eardrum, which is a very thin structure. So because of the infection, if the drum gets damaged, what happens is the sound normally passes by vibrating the drum. If the drum is not vibrating, then the sound cannot pass properly to the middle ear and the inner ear. So that causes hearing loss. So that is because of that reason, the infection leading to a damage to the eardrum can lead to hearing loss. And if there are any infection that can damage the small bones that are there in the middle portion of the ear, so that can also lead to hearing loss. So hearing loss is one of the major consequence of a middle ear disorder.
We'll just take.
And we'll continue.
We'll continue after this. Hello.
Hello?
Welcome to live phone-in program. Please ask your question.
Okay. So my son is 3 years old. He has got recurrent ear infections, and I am just concerned whether he will develop hearing loss in near future or something like that.
Okay. Recurrent ear infections. 3 years old child, right?
Yes.
Okay. So our ENT doctor will answer your question, Dr. Swati.
Madam, you told that your child is 3 years old. So
Yeah.
may I know about his breathing pattern? Does he breathe through his mouth during the nights? Does he have snoring or any symptom pertaining to his nose?
Oh, nothing like that, ma'am.
Nothing like that. Okay. So it's is he allergic? Like to ice cream or cold food
he's
stuff?
not.
He's not allergic also. Does he have anything like inserting anything to his ears often?
No, nothing like that.
Okay, so in that case, ma'am, it's better you come back here once so that we can have a look at his ears. And if at all there is any faulty habit, we can counsel him in avoiding the same.
Okay, sure, ma'am.
Yeah.
Okay. Thank you.
Thanks for calling. So, Dr. Prashant, we were discussing about the middle ear infections. Is there any influence on hearing?
Yeah, so continuing with that, as I said, middle ear infection can lead to hearing loss. And the other problems that it can lead to is, as I said, there can be a ringing sensation that can be heard in the ears. We call it as tinnitus. And as Madam also said, sometimes it can also lead to vestibular problems, what we say, something like getting giddy or getting a rotatory sensation and all that, because the infection, if it's not treated early, so what can happen is it can damage the inner portion of the ear also. So the inner portion of the ear is also responsible for our balance. So our ear has major two functions. One is hearing, and also we have the function of balance. So if that gets compromised, if that gets affected, what can happen is that can lead to symptoms of giddiness, the person getting a rotatory sensation and all that. So that is more dangerous. So considering that, whenever a person experiences any symptoms of ear pain or ear discharge, the person has to go and consult an ENT doctor as early as possible so that the medicines can be given and it can be treated early such that it doesn't spread so much, and if it spreads then again it has more complications. So early identification and early intervention is important for the medullary infection.
So, Dr. Swati, as we were discussing about the medullary disorders and medullary infections, is there any medical treatment or surgical options for that?
It depends upon the presentation of the patient.
Okay.
Suppose it is in the initial stage, that is the acute stage. So we have to diagnose the condition and then treat the condition first. If it recovers on its own, then there will be no role of surgical management.
One second, we'll just attempt a call and we'll continue that. ಹಲೋ ಹಲೋ ಹೇಳಿ ಸರ್. ಹಲೋ
हेलो
ಯಾ ಹೇಳಿ ಮೇಡಮ್ ಪ್ಲೀಸ್
हाँ,
आस्क योर क्वेश्चन.
मेरे कान में दर्द होता है, सर्दी सर्दी होता है, तो ऐसा क्यों होता है? मेरा डॉक्टर से यही क्वेश्चन है।
आपका उम्र कितना है माँ?
मेरा उम्र 30 साल है।
प्रॉब्लम क्या है और एक बार रिपीट करते हैं.
जब भी सर्दी होता है तो मेरे कान में कुछ दर्द होता है, ऐसा क्यों होता है?
और एक
मैडम, आप हमेशा सब लोगों को कान और नाक में कनेक्शन होता है एक ट्यूब के वास्ते. सो जब भी आपको सर्दी है, शायद आपको एलर्जी की प्रॉब्लम है, आप बहुत टाइम छींकते हैं आप?
ये ऐसा तो नहीं होता।
कंटिन्यूस पानी जैसा जाता है नाक से?
नाक से ऐसा नहीं होता, लेकिन सर्दी में कॉमन कोल्ड।
हाँ ठीक है. इस कनेक्शन जो भी मैंने आपको बताया अभी, एक ट्यूब होता है कनेक्ट करने के लिए कान और नाक को. सो जब भी हमारा नोज़ का कुछ प्रॉब्लम होता है तो वो कान को भी अफेक्ट करता है, क्योंकि प्रेशर मेंटेनेंस ठीक तरह से नहीं हो पाता, तो इसलिए आपको कान का दर्द भी महसूस हो सकता है. तो आपको सोचना है कि आपको क्या खाने से या डस्ट एक्सपोजर से या क्या किसकी वजह से आपको ऐसा होता है वो आपको अवॉइड करना है. शायद वो करने के बाद आपका सिम्टम्स भी कम हो सकता है.
अगर एलर्जी कम हुआ तो मेरा सिम्टम भी कम हो जाएगा?
या करेक्ट.
ओके, थैंक यू मैम.
या
थैंक्स फॉर कॉलिंग.
ओके, थैंक यू.
So you were discussing about the
surgical
management.
management. So medical management will suffice in some conditions known as acute otitis media, where only the eardrum will be affected, but there will be no perforation as such. In some cases, because of trauma, like we made a mention of using earbuds or any sharp objects, following the usage, there can be a tear in the eardrum. Usually within 2 to 3 months of time, it will naturally heal on itself, like spontaneous healing is possible. Suppose that fails, and if the person continues to follow the faulty habits, so then it can result in persistent ear discharge. So the ear discharge might be very much continuous, also along with the process of hearing loss. So in those situations, we might have to consider for surgery.
So, Dr. Prashant, if the surgical procedure not possible in the person, so what can be the amplification devices that can be provided to that person?
Okay, so surgery is the best option to treat the condition. So sometimes there will be patients in whom surgery might have been done, but maybe for some reason it was not successful. That could be one reason. Or the person may not be suitable for surgery. So maybe his age, he cannot take a surgery because of the medical risks that are present. Okay, so and there are patients with multiple treatment attempts also they may not have recovered because of the medullary infection. In such case, as you mentioned, so we can give an amplification device. An amplification device, a common term would be a hearing aid or a device that we can give which amplifies the sound. So though the person has infection, but if it is not getting treated, so then we can give a hearing aid for the patient. So the person has hearing loss due to the infection, so the person is not able to hear sounds which are soft. So what does a hearing aid do is, hearing aid would amplify. It's just like a loudspeaker. It will have a microphone which picks up the signal and it will amplify the sound and give the sound to the ear.
So we'll discuss after this call. Hello.
Hello. Yeah.
Yeah. Please ask your question, sir.
Yeah. Hello.
Hello.
Hello. It's Deepak.
Yeah. Please.
It's Deepak from Bitmahla.
Yeah. Yes, Deepak, sir. We are able to hear you. You can ask your question.
Yeah. Swati, it's Dr. Swati, right?
Yes.
Yes.
Yeah. Ma'am, I have a doubt. Actually, the Asian people and the village people, they will put hot oil to the ears so that it dilutes the wax and then it will come out. So that's the belief they have in their mind, or I don't know how they will do this thing. So it is okay or what? It's not doing things. It's okay to do these things or not?
We got your question, sir.
Yeah.
Yes, sir. I got your question. Like I made a mention of this before, and you also rightly told, in the previous years, the village people and even probably our ancestors would be advising us on the same. But it is not a good habit to follow, because our ear canal will have certain normal bacteria also lined up along the skin. So by using this oil, it might damage our skin structure itself, and it might give way to other infections to arise. So it's better we do not follow all these kind of habits, sir.
Okay, thank you, ma'am. Yeah.
Thank you, sir. Thanks for calling.
Thank you.
So, Dr. Prashant, we were discussing about the amplification devices, persons who may not have a success rate with the surgical procedures. So what you will suggest?
Yeah, so as I was telling, we can give a hearing aid to them. So hearing aid does amplification. So the soft sounds which they are not able to hear, so they can hear with the hearing aid. So hearing aids are an option which can be given for those who have infection also, which cannot be treated, but they should not be using it whenever there is an active discharge. If there is an active ear discharge coming, in such cases they should not be using the hearing aid. And compared to those people who have problem in the inner ear, so the benefit that a person with middle ear problem gets is slightly more, because they have their inner ear normal. Only problem is, due to the middle ear problem, they are not able to hear soft sound. So with an amplification device, they can benefit better. Okay, so and we can give different types of amplification devices also, but sometimes the devices which are kept come in the canal, so sometimes that is avoided, because if the discharge happens all of a sudden, so then that can go to the hearing aid and that can damage the parts in the hearing aid also. In such cases, it is preferred that we give something which is like a behind the ear, which we may not, which is not in the canal. So hearing aids are an appropriate option for those people in whom medical management may not be possible.
Dr. Swati, like as we discussing about the middle ear disorders, so it can be treated with the surgical options, even though people might oppose that we should not go for ear surgeries and all. So what do you advise on this? Is it safe to go for ear surgery? What is the success rate of ear surgeries?
Like my colleague just told, upon the hearing loss, suppose there is a ear drum perforation and that would have resulted in hearing loss. So if it is just confined to that much amount, like the conductive component, say around 40 to 50% like that, with the nerve being normal, then I would suggest to go ahead with the surgical modality, because it will be completely reverted back to a normal, near to normal hearing. Whereas if the nerve it is also affected, in addition to the eardrum perforation, along with the 3 bones which I just made a mention of, then though the surgery is done, inevitably if a person gets the surgery done, then in spite of it, he or she might have to go along with the hearing aid as well. So it's a common human tendency, moment we utter the term surgery, they'll be like, oh, should we really get surgery done, is the common notion what a normal man has.
Yeah, many people will scared about
Yes.
the surgery.
So in that cases, we need to like counsel the patient about what procedure will be done and the possible complications, and then after taking a consent, we can proceed.
We'll just take a photo. ಹಲೋ
ಹಲೋ
ಹೇಳಿ ಮೇಡಮ್.
ಸರ್, ನಾವು ನಂಜನಗೂಡಿಂದ ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ.
ಹಾಂ ಹೇಳಿಮ್ಮ.
ನನ್ನ ಹೆಸರು ತೇಜಸ್ವಿನಿ ಅಂತ.
ಓಕೆ.
ನನಗೆ ಈಗ ಒಂದ್ ಸ್ವಲ್ಪ ಕಿವಿಯಲ್ಲಿ ಶಬ್ದ ಬರ್ತಾ ಇತ್ತು ಒಂದು 20 ದಿವಸದ ಹಿಂದೆಯಿಂದ.
ಓಕೆ.
ನಾನು ಇಲ್ಲೇ ನಂಜನಗೂಡ್ ಡಾಕ್ಟರ್ ಹತ್ರ ತೋರಿಸಿದೆ. ಅವರು ಕಸ ಇದೆ, ವ್ಯಾಕ್ಸ್ ತರ ಇದೆ, ಕ್ಲೀನ್ ಮಾಡ್ಬೇಕು ಅಂತ ಒಂದು ಡ್ರಾಪ್ಸ್ ಬರ್ಕೊಟ್ರು.
ಓಕೆ.
ಅದಾದ್ಮೇಲಿಂದನೂ ಇನ್ನೂ ಶಬ್ದ ಬರ್ತಾನೆ ಇದೆ.
ಓಕೆ.
ತುಂಬಾ ತಲೆ ಎಲ್ಲ ನೋವುತ್ತೆ.
ಓಕೆ.
ನಿದ್ದೆನೂ ಬರ್ತಾ ಇಲ್ಲ.
ಡ್ರಾಪ್ಸ್ ಯೂಸ್ ಮಾಡಿಬಿಟ್ಟು ಆಮೇಲೆ ENT ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದ್ರಮ್ಮ?
ಕನ್ಸಲ್ಟ್ ಮಾಡಿದ್ವಿ ಸರ್ ಅವರು.
ಓಕೆ.
ಅವರು ಏನಿಲ್ಲ, ಮೇಲ್ಗಡೆ ಒಂದ್ಸತಿ ಕಿವಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿ ಅಂದ್ರು.
ಓಕೆ.
ಕಿವಿ ಪರೀಕ್ಷೆನೂ ಮಾಡಿಸ್ದೆ, ಅಲ್ಲೂ ಏನೂ ತೊಂದರೆ ಇಲ್ಲ ಅಂತ ಅಂದ್ರು.
ಓಕೆ.
ಅಂದ್ರೆ ಇನ್ನೂ ಶಬ್ದ ಬರ್ತಾನೆ ಇದೆ, ಆದ್ರೆ ಯಾವಾಗ್ಲೂ ಇರಲ್ಲ, ಈಗ ಸ್ವಲ್ಪ ಅವಾಗ ಬರ್ತಾ ಇರತ್ತೆ ಅಷ್ಟೇ.
ನಮ್ಮ ಡಾಕ್ಟರ್ ಸ್ವಾತಿ ಅವರು ನಿಮ್ಮ ಕ್ವಶನ್ಗೆ ಆನ್ಸರ್ ಮಾಡ್ತಾರೆ.
ಸರಿ ಸರ್.
ಅಮ್ಮ, ಇನ್ನೂ ಡ್ರಾಪ್ಸ್ ಉಪಯೋಗಿಸ್ತಾನೆ ಇದ್ದೀರಾ ಕಂಟಿನ್ಯೂಸ್ ಆಗಿ?
ಇಲ್ಲ, ನಿಲ್ಲಿಸ್ಬಿಟ್ಟೆ. ಇದೊಂದು ಅದೇ 20 ದಿವಸ 1 ತಿಂಗಳು ಹತ್ರ ಆಯ್ತು, ನಿಲ್ಲಿಸ್ಬಿಟ್ಟೆ ಅಮ್ಮ ನಾನು.
ಓಕೆ, ಫೈನ್. ಇದು ಬಿಟ್ಟು ಮುಂಚೆನೇ ಹೇಳ್ದಂಗೆ ಕಿವಿಗೂ ಮತ್ತು ಮೂಗಿಗೂ ಒಂದು ಟ್ಯೂಬ್ ರೀತಿ ಕನೆಕ್ಷನ್ ಇರುತ್ತೆ ನಮ್ಗೆಲ್ರಿಗೂ. ಸೊ ಅದ್ರದ್ದು ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಾ ಅಂತ ನೋಡಬೇಕಾಗುತ್ತೆ. ಅದನ್ನು ಬಿಟ್ಟು ನಿಮಗೆ ಪದೇ ಪದೇ ಗಂಟಲು ನೋವು ಅಥವಾ ಶೀತ ಆಗ್ತಾ ಇರುತ್ತಾ?
ಶೀತ ಅವಾಗ ಆಗ್ತಾ ಇರುತ್ತೆ.
ಓಕೆ.
ಆದ್ರೆ ಏನ್ ನೆಗಡಿ ಆ ತರ ಅಂತ ಅಲ್ಲ, ಒಂದ್ ಸ್ವಲ್ಪ
ಎಲರ್ಜಿ ಥರ ಏನಾದರೂ ಇದೆಯಾ?
ಅಷ್ಟೇ, ಒಂದ್ ಕಿವಿ ತುಂಬ್ಕೊಂಡಂಗೆ ಸ್ವಲ್ಪ ಹೊತ್ತು ಅನ್ಸುತ್ತೆ, ಆಮೇಲೆ ಸರಿ ಹೋಗುತ್ತೆ.
ಅದೇ ಎಲರ್ಜಿ ರೀತಿ ಇತ್ತು ಅಂತಂದ್ರೂ ಕೂಡ ನಿಮ್ಮ ಕಿವಿಗೆ ಈ ರೀತಿ ಅಫೆಕ್ಟ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆಮ್ಮ. ಸೊ ಹಾಗಾಗಿ ಕಾಮನ್ ಆಗಿ ನಿಮ್ಗೆ ಏನಾಗಲ್ಲ, ಅಂದರೆ ಧೂಳು ಇರ್ಬೋದು ಅಥವಾ ಒಂದು ಪರ್ಟಿಕ್ಯುಲರ್ ಹಣ್ಣು ತರಕಾರಿ ಯಾವುದಾದ್ರೂ ಒಂದು ತಿನ್ನುವ ವಸ್ತು ಇರ್ಬೋದು. ಸೊ ಅದನ್ನು ನೋಡಿ ಅವಾಯ್ಡ್ ಮಾಡಿ. ಮತ್ತು ಕಿವಿ ಪರೀಕ್ಷೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ರಿ ಅಲ್ವಾ, ಕಿವಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿದ್ರಾ ಅಲ್ಲಿ?
ಕಿವಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸಿದೆ ನಾನು. ಅವ್ರು ಹೇಳಿದ್ರು ಕೇಳಿಸ್ಕೊಳ್ಳೋದ್ರಲ್ಲಿ ಏನು ತೊಂದರೆ ಇಲ್ಲ ಅಂತ, ಡ್ರಾಪ್ಸ್ ಬರ್ಕೊಡ್ತಾರೆ ಕೆಳಗಡೆ ಹೋಗಿ ಅಂತ, ಅಂದ್ರೆ ENT ಡಾಕ್ಟರ್ ಹತ್ರ.
ಓಕೆ, ಒಂದ್ಸತಿ ನಮ್ಮ ಇನ್ಸ್ಟಿಟ್ಯೂಟಿಗೂ ನೀವು ಬಂದು ಭೇಟಿ ಮಾಡಿಮ್ಮ. ಇನ್ನೊಮ್ಮೆ ಒಂದ್ಸತಿ ನಿಮ್ಮದು ಕಿವಿದಲ್ಲಿ ಏನಾದರೂ ತೊಂದರೆ ಇದೆಯಾ ನೋಡಿಬಿಟ್ಟು ಆಮೇಲೆ ತಿಳಿಸ್ಬೋದು.
ಆಯ್ತು ಆಯ್ತು.
ಆಮೇಲೆ ಅದ್ರ ಜೊತೆ ಈಗ ನಿಮಗೆ ಕಿವಿಲಿ ಕುಯ್ಯಂತ ಶಬ್ದ ಬರ್ತಿದೆ ಅಲ್ಲ, ಆ ಶಬ್ದಕ್ಕೆ ನೀವು ಏನಕ್ಕೆ ಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಈಗ ನಮಗೆ ಏನೋ ಇನ್ಫೆಕ್ಷನ್ ಆದಾಗ ಶಬ್ದ ಸರಿಯಾಗಿ ನಿಮ್ಮ ಕಿವಿಗೆ ಹೋಗ್ತಿರೋದಿಲ್ಲ. ಅದಕ್ಕೆ ಅದನ್ನು ಕಾಂಪನ್ಸೇಟ್ ಮಾಡೋಕ್ಕೆ ಒಂಥರ ಸೌಂಡ್ ನಿಮ್ಮ ಕಿವಿಲಿ ಗುಯ್ ಅಂತ ಬರ್ತಿರುತ್ತೆ. ಯಾವಾಗ ಇದು ಇನ್ಫೆಕ್ಷನ್ ಎಲ್ಲ ಸಂಪೂರ್ಣವಾಗಿ ಕ್ಲಿಯರ್ ಆಗುತ್ತೋ ಅವಾಗ ಆಟೋಮೆಟಿಕ್ಕಾಗಿ ಆ ಸೌಂಡ್ ಬರೋಂಥದ್ದು ಕಡಿಮೆ ಆಗುತ್ತೆ. ಈಗ ಅದು ಕಡಿಮೆ ಆಗಬೇಕಾದ್ರೆ ಅದು ನೀವು ಇಲ್ಲಿ ಬಂದು ತೋರಿಸಿ ಮೆಡಿಕೇಶನ್ಸ್ ಎಲ್ಲ ತಗೊಳ್ಳೋ ತನಕ ನೀವೇನು ಮಾಡಬೇಕಾಗತ್ತೆ ಅಂದರೆ, ಅದ್ರ ಕಡೆ ಆದಷ್ಟು ಗಮನ ಕೊಡೋದನ್ನು ಕಡಿಮೆ ಮಾಡಿ. ಅಂದರೆ ಈಗ ಶಬ್ದ, ಅಯ್ಯೋ ನನಗೆ ಚೆನ್ನಾಗಿದ್ದೆ, ಸಡನ್ನಾಗಿ ನನ್ನ ಕಿವಿಯಲ್ಲಿ ಶಬ್ದ ಬರ್ತಾನೆ ಇದೆಯಲ್ಲ ಅಂತ ನೀವು ಎಷ್ಟು ಯೋಚನೆ ಮಾಡ್ತೀರೋ ಅದು ಇನ್ನೂ ಸ್ವಲ್ಪ ಅದು ಜಾಸ್ತಿ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಅದಕ್ಕೆ ಅದ್ರ ಪಾಡ್ಗೆ ಅದು ಇರಲಿ ಅಂತ ನೀವು ಬಿಟ್ಟಷ್ಟು ಅದು ಇನ್ನೂ ಬೇಗ ನಿಮಗೆ ಅದು ಕ್ಯೂರ್ ಆಗುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ಶಬ್ದಕ್ಕೆ ಅದ್ರ ಪಾಡ್ಗೆ ಅದು ಇರಲಿ ಅಂತ ಬಿಡಿ. ಆಮೇಲೆ ಇನ್ನೊಂದು ಸಲ ಇಲ್ಲಿಗೂ ಬಂದು ಇನ್ನೂ ಸ್ವಲ್ಪ ಡೀಟೇಲ್ಡ್ ಟೆಸ್ಟಿಂಗ್ ಏನು ಬೇಕು ಅದನ್ನು ಬೇಕಾದ್ರೆ ಇಲ್ಲೂ ಮಾಡ್ತೀವಿ. ಸೊ ಮಾಡಿ ಅದಕ್ಕೆ ತಕ್ಕಂಥ ಅಪ್ರೋಪ್ರಿಯೇಟ್ ಮೆಡಿಕೇಶನ್ಸ್ ಕೊಟ್ಟರೆ ನಿಮಗೆ ಅದು ಸಂಪೂರ್ಣವಾಗಿ ಗುಣ ಆಗುತ್ತೆ, ತೊಂದರೆ ಇಲ್ಲ.
ಸರಿ ಸರಿ ಸರಿ.
ಓಕೆ ಅಮ್ಮ, ಥ್ಯಾಂಕ್ ಯು ಅಮ್ಮ.
ಥ್ಯಾಂಕ್ ಯು.
So we were in the surgical management. So first is to explain the patient about the procedure, what we will be doing, and not all of us are alike. Some amount of difference is said to be there. So before we proceed, based on the condition of the ear, we might advise them to get a CT scan done, and then we may proceed accordingly. And the probable complications, like to mention a few, following ear surgeries, they might have giddiness, and in some individuals, there can be a probability of developing a facial nerve paralysis as well. So these kind of things will be explained to the patient before the surgery is done, and then we can go ahead.
Okay, Dr. Swati, like people might not knowing that they have to go to ENT, and is ENT doctors are available all over the rural places, like even in the villages and all?
Yes, ENT people are definitely available at the village level. PHC, that is Primary Health Care Center, can be like they can go ahead in consulting the person over there. Suppose if there is no ENT person over there, then they can accordingly refer to the next higher center, like a community health center, and from there on a tertiary level center, like for example our institute.
Question: if the person is having ear infections or ear medullary disorders, what are all the initial hearing loss symptoms that a person might have?
So if a person has any medullary infection, so the common symptoms that they come up with is they may complain of ear pain, saying that there is pain in my ears, or one of the major complaint is discharge. So there could be water-like fluid coming from the ears, or it could be foul-smelling, whitish liquid that can come from the ears. So all that are clearly an indication of an infection. Some people may have with this, along with that, there could be itching sensation that may be there, and tinnitus, the sound coming in the ear. So that can also be one of the initial symptoms that there could be a medullary infection. And the ears may get blocked, so the feeling of blocking sensation, as ma'am was explaining, there is a tube that connects my nose to the ear. So if that gets blocked, what happens is the air from outside doesn't go to the middle ear. So because of that, what happens is there would be a negative pressure inside the middle ear. So that causes your eardrum to go back, so that there would be a blocking kind of a sensation due to the eustachian tube blockage, the tube that gets blocked. So blocking sensation could also be one of the initial symptom of an ear infection. So any person who gets any one of these symptoms, so they should suspect that they might be suffering from an ear infection, and they should consult an ENT surgeon as early as possible for an appropriate management.
So, as Dr. Prashant said, what are all the general ear care tips that we can take, or to avoid the ear infections or ear medullary disorders?
First of all, I would like to say to trust your instinct. That is, if we ourselves are able to feel that okay, my hearing is not that okay like how it was before. So it's the first immediate step is to consult an ENT doctor and accordingly proceed with the diagnosis and as well as the audiometry, the audiological evaluation, because there is one entity known as sudden sensory neural hearing loss. So if the person comes at an early stage, say within 48 hours after the onset of the symptoms, there is a high chance that it could be reverted back to normalcy. So first is that. And whenever a newborn baby is there, always ask for a hearing screening test just to ensure that the child has a normal level of hearing. And if in a family or amongst your relatives or friends, if they complain about hearing loss, so it's always better to suggest them to go ahead in consultation to an ENT surgeon. And in those children or elderly who are being rehabilitated by the hearing aids and the cochlear implants, a proper guide has to be given on maintaining of these devices And if they are having any discrepancies in hearing and all that, better to come back again for a follow-up and a repeat audiogram evaluation so that it could be set to the required hearing loss levels. And always we have to encourage those people who are working in industries having very loud noises to use the earplug devices. And one common thing what people tend to assume on their own is, previously I had this kind of ear problem, so I was prescribed this medicine. So now also I'm having the same thing, so let me just start using the previous medicine. So that should be curbed. Be it the same problem or different problem, it is always better to consult the ENT person so that the proper diagnosis is arrived at and the treatment also will be appropriate.
So what about the children's, doctor? Like if they are having accumulated earwax accumulation in the ear canal, so how it can be removed in case of child cases?
Yes. So in children also, like we just had a talk on the production and all that. So there are some factors which result in accumulation of earwax within the canal. They are pertaining to the anatomy itself. So as you can see in this picture, the ear canal here, for our understanding, it is shown as a straight tube, but in reality it is not a straight tube, it is an S-shaped tube. So if the obliquity is too much, or if the hair follicles, as I made a mention of in the very first talk of mine, so if they are not moving properly, so these might result in their accumulation.
We'll come back after
Yeah.
taking this call. Hello.
Hello.
Yes, please ask your question, madam.
Yeah, so good afternoon, sir.
Yeah, good
So,
afternoon.
मेरा ये question था कि recently my sister had a baby and like in Apollo कुछ tests हुए थे, but we were told that सब कुछ normal है,
Okay.
but हमें नहीं पता कि क्या tests हुए थे. तो अगर आप कुछ details बता सकते हैं उन tests के बारे में.
Okay. Dr. ENT Swati, answer.
नमस्ते। जैसे मैंने कहा कि बच्ची पैदा होने के बाद रूटीन होता है हियरिंग टेस्ट करने के लिए, तो एक बेसिक बेडसाइड टेस्ट का नाम है ऑटो अकॉस्टिक एमिशन, जो कान के अंदर प्रोब जैसा डालकर साउंड वेव्स सब भेजने के बाद उसको रेस्पॉन्सेस सब रीड करते हैं। तो इसके बारे में मेरी कोलीग आपको बता देंगे।
So to answer further, like now we have something called as universal newborn hearing screening. So सभी बच्चे जब वो पैदा होते हैं, so सभी बच्चों को कान का टेस्ट करवाया जाता है। So कौन कौन सा टेस्ट होता है? So usually as ma'am said, auto acoustic emission. So ये टेस्ट करता है कि कान का अंदर का भाग जो होता है, सो ठीक तरह से काम कर रहा है कि नहीं, वो हमें ऑटो अकॉस्टिक एमिशंस ए टेस्ट से हमें पता लगता है। और उसके अलावा हम जस्ट बिहेवियरल ऑब्जर्वेशन भी करते हैं। तो जब एक साउंड करके बच्चा अगर मीन स्लीप से अगर जागता है और वेदर कुछ स्टार्टल रिस्पॉन्स आता है, वो सब कुछ भी हम देखते हैं। सो ये कॉमन सी टेस्ट होते हैं। सो दीज आर द कॉमन वंस, बिहेवियरल ऑब्जर्वेशन एंड the auto acoustic emission tests that are done. So that will tell us whether the inner ear is functioning properly or not. So these are the common tests done, but for some cases we do something called as brainstem responses also. So that will also help us to screen whether the baby is having normal hearing or not. So whenever we get a refer response, then a detailed testing needs to be done. So what you need to do is the autoacoustic emissions, if it comes normal, no worries, the baby is listening, but you should also keep monitoring the child's speech and language development. That is like the child has to start speaking by around, start saying words by around 9 months or 1 year of age. So the child, whether if there is any delay that if you are seeing, and even after like 6 months, if you observe that the child is not responding, then also you should come back and get an audiological testing done, because there can be a chance of late onset also. But since your baby is tested normally, so nothing to worry, just monitor the speech and language development, and that should be enough.
Okay, all right, sir. Thank you so much.
Thank you for calling, madam.
Thank you.
Dr. Swati, we are discussing about the children's.
Yes, so that would be the state in a child or even in an adult. So that will be the normal anatomical factors like change in the normal ear canal, its orientation, along with the absence of some glands like ceruminous glands, and the sebaceous glands might be deficient even. So there are two types of wax actually, like the dry wax which lacks the ceruminous glands, and the wet wax which is rich in the ceruminous glands. So if these factors contribute in impaction of wax resulting in the various symptoms which we just made a mention of, then the options for them in those conditions would be, first is to soften the wax. So we prescribe what is known as the wax solvents or the waxolytic agents. So this results in softening of the wax, following which it will be easy for us to remove the impacted wax. So for its removal, so we can accordingly follow either syringing method, wherein a syringe filled with normal saline at the body temperature might be used. We irrigate the ears, and then whatever wax has been accumulated will come out. Or we can also use what is known as suctioning procedure. That is, this works based on the vacuum principle. So it just there will be a suction tip. So on switching on the instrument, a vacuum gets created, and on inserting it into the ear, it will just suck out the wax, whatever is present. Suppose if we use both these techniques, and if we are not able to clear it, then we can use what is known as a hook.
We'll just take a look. Hello. Hello.
हेलो.
Yeah. Please ask your question, madam.
हाँ, मैं महाराष्ट्र से मानसी बात कर रही हूँ.
जी बोलिए.
मेरे दादाजी ना कान का मशीन इस्तेमाल करते, कान के पीछे वाला होता है ना,
हाँ यार.
उसको ना बहुत कान में मैल जमा हो रहा है, और उसकी वजह से कभी कभी ज्यादा दिक्कत होता है. तो उसके लिए क्या कर सकते हैं सर, ये पूछना था मुझे.
आपको डॉक्टर प्रशांत आंसर करते हैं.
ओके सर.
कान का मशीन वो मोल्ड के साथ यूज करते हैं कि नहीं?
हाँ हाँ सर, माप बनवाया है उनके लिए.
हाँ. सो क्या करना है कि जब वैक्स अक्यूमुलेट होता है कान में, सो ये चांसेस होता है कि मोल्ड का वो जो होल होता है उसमें वैक्स जमा होने का चांसेस है. सो क्या करना है कि आप ऑलमोस्ट अगर ज़्यादा वैक्स फॉर्मेशन होता है तो एवरी वीक वंस वो मोल्ड को रिमूव करके वो मोल्ड को क्लीन करना होता है. सो उसके क्लीन करने से उसमें ब्लॉकेज नहीं होगा. सो अगर मोल्ड में ब्लॉक हो जाएगा तो कान में ठीक से आवाज़ हियरिंग एड में नहीं जाएगा. इसलिए मोल्ड को आपको निकाल के थोड़ा गर्म पानी में आपको क्लीन करके उसको पूरा ड्राई करके उसके बाद आपको मशीन में लगाना है. अगर ज़्यादा रेगुलरली अक्यूमुलेट हो रहा है तो रेगुलरली आपको ENT डॉक्टर के पास जाके उनसे ईयर वैक्स रिमूव करना होगा. सो अगर वैक्स है तो रेगुलरली एवरी वीक और एवरी 15 डेज आपको मोल्ड को क्लीन करना होगा.
ओके सर, ठीक है. थैंक यू सर.
थैंक्स फॉर कॉलिंग.
Yes, so we were discussing about the methods of removal of wax. So syringing is one of the options, followed by suctioning. The third one is what is known as a hook or a Jobson horns probe. So here between the canal skin and the wax, we are supposed to create some space and hook it on the wax and just pull it out. So these are the ways in which the wax can be cleared by us.
Dr. Swati, what are the causes for ear ditches? We generally see ear discharge in the ear canal. So what are all the causes for those things?
So like I made a mention of it earlier, so periodic or continuous usage of earbuds or any other objects would irritate our normal lining epithelium or the skin within the canal. So because of which the normal bacterial flora might get might be affected, and this will result in a infection being set up. So it could be ranging from just a small swelling, which is known as furuncle, which could be extremely painful. So this might rupture and result in a pus formation or a purulent discharge. So this could be one of the conditions. And next, followed by the fungal infection, that is otomycosis. Some individuals might tend to say the appearance of a blackish white discharge or debris, something like that. So that goes in favor of a fungal infection. So apart from these, like we had the discussion on the eardrum deficit or the perforation. So the whatever middle ear fluid gets secreted, the quantity of this might increase if there is a focus of infection within the middle ear. So this can also give rise to a mucoid or a purulent ear discharge. So these are the various causes of ear discharge.
What are all the general tips that you can suggest for the public to take care of outer ear and middle ear from the ear discharge or ear pain?
So I would just like to tell the public to not insert anything at all to the ears, be it earbuds or whatever, any other object, and kindly don't ignore anything pertaining to your ear, be it ear pain or ear discharge, because you never know, it could be a potential cause for hearing loss, which could be even permanent. And kindly don't treat any ear infection on your own. So like I just made a mention earlier, some ear drops prescribed to any other relative of yours or any other family member, so it should not be taken into consideration, or it should not be assumed that okay, the same thing can be used even by me. So than helping, it would actually further deteriorate the condition. And like all of us know, the present day trend in such an advanced technology and science
Yes.
world we are in, so many individuals have the habit of using and listening to music with the earphones or the headphones. So I strongly advise them and suggest not to use that. Of course, may not be in the near future they will experience about the hearing loss and all that, but definitely in the long term it will have a bearing on their hearing. So just don't ignore anything about yourself. That is what I would like to say.
Thank you, Dr. Swati. So, Dr. Prashan, what is the importance of hearing, and can you give some tips on hearing care? So what are all the care that they can take?
Okay, so with respect to the hearing care, and just to add on to what ma'am just said, it's like any symptoms, it should not be ignored. So any complaint of ear pain, ear discharge, or any blocking sensation or a ringing sensation in the ear, so nothing should be ignored, and it should be immediately brought to the concern or go to a doctor and get their ears checked. And it should be a practice to get, if you have a constant problem of earwax, get regularly checked by an ENT doctor and going to an audiological testing, so that is regularly advised. And another cause of ear infection would also is seen in swimmers whenever they go to swim, and if the water enters and if it is not clean and all that, so that can easily lead to ear infection. So we can get an ear plugs or a swimmer's plug, so that can be done at Aish as well or at other places too. So that using that is always advised to prevent ear infections and avoiding the entry of water. So taking care of all the precautions that we have discussed today, so if we follow that, then we can take care of our ears and our hearing better.
Thank you, Dr. Prasad. So we are almost end of today's program. I would like to add on and say ears are auditory sense organs of our body. So please take care of your ears and protect your hearing by yourself. I'd like to thank both the resource persons, Dr. Swati Chandresh and Dr. Prashant Prabhu for answering all the questions put forth. I hope it was helpful to all of you out there who participated in the program. Your feedback and suggestions are always welcome. For any queries and further assistance on tele-assessment and management of ear and speech related problems, do contact us at 0821 250 2536 or mail us at aistelecenter@gmail.com, or alternatively you can look into our website www.aishmysore.in for additional information and online appointments. We look forward to hearing from you. Thank you very much.